Okay. So, patient has had a consultation in advance of the procedure. I've summarised the procedure that we're going to do. I've answered any questions that the patient may have, and I've gained written consent for the procedure. I've also confirmed which leg we're going to treat by putting a little mark, surgical indelible pen mark, on the leg to confirm that that is the leg that we're going to treat. And we've now prepared the leg and got the patient on the procedure table to do the procedure for him now. The setup of the room is such that I'm going to stand on the patient's right. I'm right-handed, and I'll be conducting the procedure from the patient's right. And from an ergonomic point of view, from the design of the treatment room and the placing of all the various people within the treatment room, we've got the ultrasound machine on the patient's left, so that when I'm performing the procedure, I am by the patient's side using my right hand to do the procedure, and I'm also looking straight ahead at the ultrasound machine, so that I am not having my neck turned to one side, and from a ergonomic point of view, it's the most efficient way of doing the procedure. We have Jane, who's going to monitor the patient, make sure that the patient is comfortable and safe. She has already attached monitor leads to the patient, and she's going to look at the monitor, which will display the pulse, the heart rate. It will look at oxygen saturation levels in the blood, and it will also measure the blood pressure. And Jane will talk to the patient throughout the procedure to make sure that the patient is comfortable and that the vital signs are all satisfactory. Should there be any concerns about the patient's well-being, Jane will communicate that to other members of the team. So Jane is next to the patient on the left, and the monitoring equipment is at the head of the treatment table, and Jane's in charge of that. Pam, who has prepared the table with all the various instruments and items that we need, will be at the foot of the table to my right. I'm right-handed, and Pam will pass me the next instrument that I require, and she will also take away instruments that I have used and no longer required during the procedure. So Pam will orchestrate the various instruments and equipment that we need. We also have on the patient's left, towards the foot, the laser equipment. Again, it has a display which I need to see, Pam needs to see, and Jane is the laser operator. She will make sure that the settings are correct, that I have access to the foot switch which starts the laser. She is in charge of the key, and she will turn the laser off if there are any safety issues. She will also supply members of the team with safety goggles. So that's how we organise the room to be the most efficient. That's for a right-handed person. Whether I treat the left leg or the right leg, I always stand on the patient's right, and we always have the ultrasound equipment directly opposite on the patient's left. We don't have a vascular technician to operate the ultrasound equipment. We have a sterile cover so that I can alter the dials and settings on the ultrasound machine without compromising sterility. And the ultrasound probe has already been covered with a sterile probe, so we can look at the patient's leg. And in a moment, when we start the procedure, I will show you how I cannulate the vein that we're going to treat with laser. That's an essential skill, and I will demonstrate that in a moment.